After reading these point and counterpoint articles, I feel as if the counterpoint argument was made. It did open my eyes a bit to be like, okay, yeah, maybe there are some things outside of what the state licensing could do that the people in the profession already could do in order to increase their licensure. But I did find it interesting that that was their reason for why nothing would be done for that point, up to that point, and because there was such a divide in actually what a clinical exercise physiologist does, is why they wouldn't license it, which I feel like in this situation, actually creating a program that is clear what you have to do in order to graduate, and also clear in what your position will be post-graduation, would really help clear the air and create a field that would be much more cohesive and understanding. I mean, it would take a few years to put into practice, and for all of the clinical exercise physiologists that have already taken the exam and are actually certified through the through the exam that they have to take, they would have some other course that would help them to still continue to stay certified. So I did agree with the point that it's better to have a state licensure, especially for something like this, where I feel like there should be more training behind a CEP than just like an athletic trainer, just because of the fact that they are working with diseased populations and trying to help prevent some death or something serious like that. So it would be important to make sure that, you know, the proper training has been put into place, and that they have enough knowledge to treat these patients how they need to. You know, the education in this kind of realm is always evolving. Like with PT, that program used to just be a bachelor's degree. Then it was moved to a master's degree. So kind of similar how these, you just need to get a bachelor's and then or a master's and then take the exam. That was pretty similar to how PT used to be, but now you actually have to go to graduate school and you become a doctor, and in order to treat the patients, and that really makes a clear path for, okay, this is how it's going to be done. This is exactly what a PT does. It does make it easier to bill insurances and get reimbursement that way, and to make sure that people aren't just saying, oh, I'm a physical therapist, even though they didn't technically get the proper training. Like, it's just a lot more clear on what needs to be done. And I personally think education is always evolving, and so yeah, it might be a little difficult, but in the end it would help the profession grow, and more importantly, help the patients that are being seen. Because in the counterpoint argument, they did say that there weren't enough reportings of serious problems coming from people who were not technically certified in training, getting hired. But it's like, how often are things like that being reported? Like, how do they know that there's not more going on behind the scenes, or that there's not a ton of people applying, or whatever? So I just feel like that point was a little bit mute and not didn't seem like it was on solid ground, if that makes sense. So I definitely think that there should be some form of clarification for the clinical exercise physiologist to know exactly how to do it, because when I was researching trying to figure out how to become one, it seemed slightly unclear as far as what was required. And it pretty much just says to get your bachelor's degree and some clinical experience, hands-on clinical experience, and then you just have to pass an ACSM test. But there's also just people who are exercise physiologists, and they don't technically have to pass. So anyways, that would just really help to clear the air, and so that is what I think.